Welcome. This webinar is hosted by the Great Plains Quality Innovation Network.
Stephanie, she wasn't posting it.
Well, for scanning.
You're okay, Stephanie. Go ahead.
Okay. Once again, welcome. This webinar is hosted by Great Plains Quality Innovation Network, the Centers for Medicare and Medicaid Services Quality Innovation Network, Quality Improvement Organization for North Dakota and South Dakota. My name is Stephanie Meduna. I am a Quality Improvement Advisor with Great Plains Quality Innovation Network. I want to thank you for joining us today. Before we get started, there are a couple of housekeeping items to review. Today's webinar is going to be recorded and will be posted within 1 to 2 business days on our website at greatplainsquin.org. All lines will be muted throughout the presentation, but please add any questions or comments to the chat. We will have time at the end of the presentation to respond to those. And well, it's that time again. Respiratory viruses become more prevalent during the fall and winter months. The importance of annual vaccination is even more critical. COVID-19, influenza, pneumonia, and respiratory syncytial virus, RSV, pose significant health risks, especially for older adults and immunocompromised individuals. Vaccination remains one of the most effective and safest ways to build immunity and to prevent serious illness, hospitalizations, and deaths. Once again, I want to thank you for joining us, and today's webinar is titled Ready, Set, Vaccinate. Next slide. Today, we are going to discuss current vaccination recommendations, resources for hosting a vaccine clinic, and tools to assess with vaccine hesitancy. Next slide. Respiratory season vaccine includes the influenza, COVID-19, the RSV, and the pneumococcal vaccines. Vaccines are a core prevention strategy to lower the risk from the respiratory viruses. Core prevention strategies are important steps you can take to protect yourself and others from respiratory virus. All residents or patients should be offered the 4 respiratory season vaccines if they currently are not up to date, and all the vaccines can be co-administered with one another. Next slide. What to know about influenza. The updated 24-25 flu vaccines will be a trivalent and will protect against the H1N1, the H3N2, and the B Victoria lineage virus. The composition of the season's virus compared to last year has been updated with the new influenza A, which is the H3N2 virus, which is a Thailand lineage. One of the 2 B strains, the Yamagata lineage, was eliminated due to the lack of circulation since 2020, making this year's a trivalent product. Like I said earlier, it can be co-administered with the COVID-19 vaccine or other vaccines, and it is recommended for everyone aged 6 months and older. ACIP voted that people with an egg allergy may receive any flu vaccine, whether they're egg-based or non-egg-based, that is otherwise appropriate for their age and health status. Additional safety measures are no longer recommended for the flu vaccination beyond those recommended for receipt of any vaccine. The effectiveness of the influenza vaccine is 33 to 67%, which is based on age. There is also a high-dose influenza vaccine called Fluzone HD, which is a high-dose vaccine that contains 4 times the amount of antigen compared to the standard influenza vaccines. It is approved for persons 65 years of age and older, and this helps to stimulate a more robust immune response. Next slide. What we need to know about COVID-19. There are 3 vaccines that are approved, one from Pfizer, Moderna, and the Novavax. The CDC recommends everyone aged 6 months and older receive an updated 2024-2025 COVID-19 vaccine. ACIP will evaluate data and make a decision concerning an additional dose during this 24-25 respiratory virus season as the season progresses. As of right now, there is no recommendation for an additional dose of the 24-25 COVID-19 vaccine. People who recently had COVID-19 may delay getting a COVID-19 vaccine for 3 months or 90 days. If you have received the 23-24 vaccine in the last 2 months, you are to wait at least 8 weeks to get that 2024-2025 vaccine. And as we've discussed, the 2023 and 2024 vaccine can no longer be given as of August 23rd, 2024. The effectiveness of COVID-19 reduces the risk of severe illness by 40 to 60%. Next slide. There are 3 RSV vaccines that are licensed by the U.S. Food and Drug Administration for use in adults age 60 and older in the United States. Arexvy, Mrezvi, and the Abrysvio are the 3 different vaccines. The CDC recommends all adults age 75 and older get an RSV vaccine. CDC recommends the RSV vaccines for all adults age 60 to 74 who are at increased risk of severe RSV disease. RSV vaccine is given as a single IM dose and is not currently an annual vaccine. The effectiveness of the RSV vaccine reduces the risk of severe illness by 82 to 86%. What to know about pneumococcal? Routine vaccination for those ages 65 and older. I'm not going to go through all the recommendations, but do want you to be aware of a few recent changes. So looking at this chart right here, if no pneumonia vaccines have been given or the status of the vaccine is unknown, the PCV20 or the PCV21 can be given. Or option B would be the PCV15 and then greater than or equal to 1 year, a PPSV23 would be given. Recently, the ACIP recommended the 21-valent PCV as an option for adults aged greater than or equal to 19 who are currently recommended to receive the PCV15 or the PCV20. The PCV21 contains 8 stereotypes that are not included in other vaccines. So looking at this, if the PCV15 is utilized and that PPSV23 needs to be given within 1 year, there is also a minimal interval that can take place between these 2 vaccines, and that is 8 weeks in between the vaccines. This is usually considered with adults who are or have a immunocompromising condition, a cochlear implant, or a cerebral spinal fluid leak. And as you can see, the other recommendations for the PPSV 23, the PCV 13, and then the PCV 13 and the PPSV 23 are outlined in this chart showing an option A that can be given and also an option B that can be given. And down below, if you look below the chart, there is also some shared clinical decision making for those already who have completed a series of PCV 13 and PPSV 23. And with that, it says equal to or greater than 5 years, the PCV 20 or the PCV 21 can be given. With all the changes in the pneumococcal vaccines, there is also an app that the CDC has and does offer. It is called the Numerex Vax Advisor. It's a free app to quickly and easily provide patient-specific pneumococcal vaccine guidance. It's available for download for the iOS and the Android mobile devices. There is also a web-based version that does not require a download that can be found on the CDC website. The Numerex Vax Advisor is what it is called. Next slide. Great Plains Quinn has prepared a vaccine clinic checklist and one also that is specific to long-term care facilities. These checklists start 4 to 6 weeks prior to your vaccine clinic taking place and go all the way to the day of the vaccine clinic. The checklist also includes a post-clinic section so you can review how the clinic went and identify any changes which need to be made for your next vaccine clinic. Both checklists are available on the GP Quinn website under the Vaccine Clinic Checklist and the Vaccine Clinic Checklist for long-term care. All right, at this time, I will go ahead and turn it over to Dee to talk about vaccine hesitancy.
All right. Well, thank you, Stephanie. And hello to those of you on the attending the webinar. I'm Dee Kaiser, an RN and Quality Improvement Advisor for Great Plains Quinn QIO. And I'd like to talk about ways to overcome vaccine hesitancy. We all deal with this, and there are some proven true things that can be done to help overcome it. So the first thing I want to talk about is dis or misinformation. There are so many social media sites that push out incorrect vaccine information, and it's hard for the consumer to know what is correct and what isn't. The best advice is to read or watch videos, information that comes from trusted resources such as the CDC, CMS, HHS, Quinn QIOs like ourselves, or other websites that give just the facts and keep personal opinions and biases out of the information. A vaccine champion with credibility in healthcare can be a great asset in promoting vaccines. You are your patients, residents, community's most trusted source on medical information. You are the ones that can provide credible information. And when a trusted source provides information that COVID-19 and influenza vaccines cut the risk of hospitalization in half in all ages and is the best protection against long COVID, and that older adults can lower their hospitalization risk by over 3 times, people listen. It's always good to ensure that everyone is being offered vaccines in the same way. Don't assume that because someone refused a vaccine in the past that they're going to refuse it this time, and always offer education, when you are asking them if they want the vaccine, and do it frequently because things change. Educational campaigns such as HHS's Risk Less, Do More, which increases awareness of, confidence in, and uptake of vaccines that reduce severe illness from flu, COVID, and RSV, especially in at-risk populations. The campaign also includes resources and featured handouts on how to help limit the spread of respiratory viruses in all populations by informing people about effective prevention measures they can take. There is information that can be included on media, including TV, radio, print, social media, and other digital platforms. And they partner with national, state, and local organizations to ensure that all audiences have access to information that can help them avoid illness, protect themselves, their families, and their communities from highly contagious respiratory viruses. So we have included a link to this campaign on our resource slide, which of course everything will be sent out to you afterwards. But it is a nice campaign to make sure that reputable, credible information is getting out to everyone. So the last thing that I want to talk about here is motivational interviewing, or MI. So let's talk a little bit more about that. As you're probably all aware, motivational interviewing, or MI, can be utilized as an approach to conversations that go way beyond just healthcare. But it has been a popular strategy and has been shown to work, particularly for improving immunization rates. So as we head into the fall vaccination season, I wanted to highlight the use of MI to address vaccine hesitancy. Different MI strategies can be helpful for conversations with patients, residents, family members, and staff that may be ambivalent about getting vaccines. I'm going to review the key elements in the spirit of MI, the core skills of MI, using the ORS Plus model, along with some information from a Boost Oregon MI workshop. So the spirit of MI refers to the underlying attitude or approach that practitioners of MI bring to their interactions. It's a crucial aspect of MI that guides how practitioners engage with people to foster motivation and commitment to change. The spirit of MI includes 4 key elements: working collaboratively in partnership with people as partners rather than taking an authoritative stance. The MI practitioner is an expert in helping people change and remembering that they are the expert of their own lives. Next is acceptance. That's embracing and valuing people for who they are without judgment, seeking to understand the person's perspectives and experiences, and expressing empathy by highlighting strengths and respecting a person's right to make informed choices about changing or not changing. Third is compassion, by actively promoting and prioritizing a person's welfare and well-being in a selfless manner. And then last is evocation, by drawing out the person's priorities, values, and wisdom to explore reasons for change and support success. People have within themselves the resources and skills needed for change. So these 4 elements are based on the principles of Carl Rogers' person-centered counseling and are essential for creating a supportive and empowering environment that facilitates change. The spirit of MI is what sets it apart from other counseling techniques, emphasizing respect, empathy, and the belief in the person's potential for change. So the MI framework includes core skills, parts of the ORS Plus model, attending to the language of change, and the artful exchange of information. So as you can see there on the slide, you want to begin by asking open-ended questions that can't be answered with a yes, no, to help engage in two-way dialogue. Try to explore and understand their perspectives, experiences, and concerns. The A in ORS stands for affirmative statements. Recognize and support their values, perspectives, strengths, and efforts. The goal is to promote a collaborative relationship, help to build the person's hope and confidence in their ability to change. Change is not an event, it's a journey. The R is reflection. Listen with reflection. Respond thoughtfully by paraphrasing. Validate their point of view. The goal is to confirm they have been heard or acknowledged. This is a foundational skill of MI and how we express empathy. And then S is summary statements. Use them to recount and clarify what the person said. Identify specific areas that they can act on. The goal is to clearly and respectfully conclude the conversation. This ensures shared understanding and reinforces key points made by the client. And then lastly, you want to offer information, but only with permission. You may offer your own experience and or information. Always ask for permission. The goal is to foster openness and connect based on respect, not to persuade or convince, which that can be hard to do when you're using motivational interviewing. You want to just say, you just need to take it. You just need to. But they have to come to that realization on their own, and using those core skills of MI can help you get there. So recently, one of our GPQ and QI advisors attended a workshop, and it was led by an MI trainer from Boost, Oregon, which is an organization that empowers people to make science-based vaccine decisions for themselves, their families, and the community, envisioning a world where people's health decisions are rooted in science. And there are 3 steps in the Boost Oregon conversation. First is to provide clear and neutral recommendations. For example, you could say something like, we will be giving influenza and COVID vaccinations at our clinic next Friday. Do you have any questions about these vaccines? If the patient, resident, or family member expresses concern or hesitation, you could offer a reflection statement back to them to show your understanding. And then move to ask if you could share information. Offer information and ask what they think of it. One way that you could build your skill with MI is to practice. Practice it for 5 minutes a day for a month. It could be with anyone. For example, with a cashier at the grocery store, or call a family member. Ask them how they are doing. Reaffirm what they are sharing. You could go something like this. If they're tired or really busy, you could say, it sounds like it's been a day for you. That's offering understanding and support. Most of us probably already include these practices in our daily conversations without even realizing it. We as healthcare workers are planners by nature. We don't need planning skills for MI. MI is about collaboration and shared decision making. It isn't so much about what you say that is impactful. It's how you made them feel. You may not get commitment that day, but you initiated the process to get there. All right, so our next slide are resources. And as you can see there are a lot of resources that we will be sending out when we send out the presentation. As Stephanie said, the vaccine clinic checklist for our generic one, and then one specifically for long-term care. That checklist is very nice in the way it goes through all of the different stages of preparation, through having your post debriefing after the event has gone on. The Pneumorex Vax Advisor link is there towards the bottom on the left-hand side. The Risk Less, Do More, which is the campaign that has great resources. There's also some links there to motivational interviewing tip sheets and a motivational interviewing webinar that was put on back in 2021. Then on the right hand side, you'll see that there's some resources there for posters and flyers. There's our 10 reasons to get vaccinated, the Think Flu, Think COVID with different types of pictures on it. Don't get sick as a dog, get your flu shot. That's one of my favorites. And then the protect those you love. Those are good. And who are you protecting? So all of that will come out again, as we said, and you can click on any of them and print them and use them in your organization. So I think we'll go on to our last slide here is thank you for joining us. And the best vaccine is the one you get. So we can use the remaining time for questions. So if you have a question, please add it to chat or feel free to unmute your line to ask a question. Okay. Also in the chat, you'll find that Kelsey has put links into the GP Quinn vaccine clinic checklist, both the generic and the long-term care, and the Risk Less, Do More HHS campaign. Okay, we do have a question here in chat. It says, I was late getting here, so not certain if I missed it. Could you please post the resources page? I only have the Risk Less, Do More. Okay, so Kelsey, if you could repost the vaccine clinic checklist, that would be awesome. Also, Jessica, you will be getting this presentation that has that resource page with all of the links on it in follow-up for being on the call today. And you are welcome. Does anybody else have any questions or any comments that they want to share today? We did go through that information fairly quickly, so if you need us to review anything, maybe you joined late or want to go back to the vaccines or the vaccine clinic checklist, just let us know. I have a question, and you can just put it into chat, or you can use one of the reactions like a thumbs up or whatever, but have you used motivational interviewing with your patients or residents in order to overcome some vaccine hesitancy? You can put it into chat if you want to, or you can just use a reaction like the thumbs up. Let's see if we get a few people. I'm not seeing anybody, but a lot of times people think that motivational interviewing is this long drawn out process that you have to do. And oh, I'm seeing some thumbs up now. Great, great. And it isn't. It's just mostly just thinking about what they've said, rephrasing it back to them, and then asking for what information they need to better have a more informed decision about the vaccine. And sometimes it doesn't work. Sometimes they'll shut you down as soon as you're trying to, ask open-ended questions, so they can't just say yes or no. And that sometimes they're going to say, I don't want to talk about this anymore. I've said no, and no is no. And so you that's it then for that day. You don't want to keep pushing, but you might go back a month later, 2 months later, and say, have you changed your mind? Do you want some more information? Because things happen. Maybe they've had a family member get COVID and now they're dealing with long COVID, and they're like, I think I do want to take that COVID shot, or I think I'm ready to do an RSV, whatever the situation is. All right. Well, I don't see anything else in chat. Hey. All right. Well, again, we thank you. And this is myself and Stephanie's contact information. So if you need more information or have questions, don't hesitate to contact us. As we close out the session, a reminder that attendees will receive a certificate of participation for submission to applicable accrediting and licensing bodies for CE credit, and the certificate will be sent via email. Great Plains Quality Innovation Network is an approved provider of continuing education with the North Dakota Board of Examiners for nursing home administrators and the South Dakota Board of Nursing Facility Administrators. Please complete the evaluation form, and link is in the chat. We will also email to all registrants following today's session. Please complete to help us plan and coordinate future events. So thank you again for joining us and enjoy your day. Thank you.
Thank you.